All right, good afternoon. Thank you so much for always keeping it TV47. It is time to be updated. TV47 at 1 begins right away with me, Linda Alela. I'll be taking you through the stories that we have compiled. And we start off with this particular one, where a section of Africa's most senior health officials have held a vital meeting with urgency in their voices and a crisis on their hands. Their concern stopping the devastating Ebola outbreak before it spreads further across the continent. And as Elizabeth Atieno now reports, African countries, especially those at the highest risk of dealing with Ebola virus disease, are now calling for concerted efforts to deal with the spread, even as they seek to have a common stand.
The ongoing Bundi-Bujo Ebola outbreak in the Democratic Republic of Congo and Uganda has exposed weaknesses in Africa's public health systems, prompting an urgent meeting of African Permanent and Principal Secretaries for Health Caucus, chaired by Kenya's Principal Secretary for Public Health and Professional Standards.
So the crucible of COVID-19, previous Ebola outbreaks, Mpox and cholera has forged a singular truth: no nation can build a fortress of health security alone.
And we have tried to consolidate all of these priority actions. And on top of the list, all the member states have asked strengthening of the borders. Another issue is the propositioning of supplies.
The virtual meeting brought together more than 60 health leaders from across Africa who acknowledged that infectious diseases do not respect borders. Discussions highlighted key challenges including weak surveillance systems, inadequate contact tracing, porous borders, and limited medical resources.
This pathogen is a brutal reminder that infectious disease threats recognize no borders, respect no sovereignty, and wait for no bureaucracy. And in our deeply interconnected internet, a fever in a border town today is a regional emergency tomorrow.
We have a modeling project where we are looking at utilizing machine learning on the estimations on probability of spillover. This guides our risk assessments and our forecast models.
Despite these challenges, leaders agreed on urgent measures to strengthen outbreak response. These include improving cross-border surveillance, enhancing laboratory capacity, protecting frontline health workers, boosting community engagement, and securing sustainable funding for preparedness efforts.
The issue of around capacity for isolation and management, and as you've seen, and also the protection of healthcare workers. You've seen we have a high number of infections among healthcare workers, both in Uganda but also in DRC.
The meeting ended with a strong message that an Ebola outbreak in one country is a threat to the entire region. Leaders pledged to strengthen cooperation, improve information sharing, and enhance regional health security to prevent further spread of the disease. Elizabeth Atieno, TV47, Nairobi.